I have no makeup on, and that's fine. But my point is, I'm going to entertain you and answer your questions live and get ready. So I'm going to do some makeup and hair while I answer your questions. So come on in to the live if you wish. And I'm going to do my makeup while we do this. And if you have questions, put it in the chat. And just FYI, people are curious. Hey guys, welcome. Hey, I am in Los Angeles. Someone else here is from Katy, Texas. Love that. Come on in. Oh my gosh, someone's been a hospice nurse for a while. That's amazing. From Canada, North Carolina, Massachusetts, UK. Wow. If anyone, you're a hospice admission nurse too? Oh my gosh, I love me hospice admissions. New York, UK. Amazing. Jose Rodriguez from California, me too. South Africa. Hey. Trophy Club, Texas. I've never heard of it. Ecuador? No, I love it. I've been a chaplain. Wow, really cool. Oh my gosh, France. Athens, Georgia. Wow, okay, amazing. I could this just amazes me that there are so many people from all over the world here. So, if any of you guys, what's the youngest patient I've helped on hospice? The youngest one was 18. I don't do peds hospice, so no children's hospice. Jen is a hospice nurse too. But 18 was my youngest. I didn't see him die because he came off hospice, and I don't know what happened to him. A lot of times when they're young, they're kind of on and off hospice. So. Someone talked to me about pulmonary fibrosis. Super side note, if anyone's really interested in a really good but cheap, kind of foundation / primer, L'Oreal BB cream, fair or medium. This is amazing. Okay, so pulmonary fibrosis. I actually don't see people with pulmonary fibrosis that much on hospice. I think because they end up dying in the hospital. I don't mean to be so blunt about this. I don't want you to think I'm taking it lightly by just being I think it's because they die in the hospital. I'm not trying to sound like that, but that is why I do think I don't see them much. I feel like they end up dying in the hospital. I don't know why. I think just because it's a really complicated and chronic illness, as you know, the person who asked me this question. So I don't see it very often. Someone else asked me about a brain tumor. Give me 1 second so I can go back into the chat. Hang in there. I have a malignant brain tumor. Will you tell Mr. what I can expect? Okay, I'm just reading what these say. So malignant brain tumors can be difficult. So I can tell you what you can expect if you go on hospice. So I don't know how long you've had this brain tumor. There's a lot of things you can do before you go on hospice, right? But if you do decide to go on hospice, we can help with symptoms. A lot of the symptoms are pain, seizures, headaches. Everyone is different, and I really mean that. Everyone is different, so it's really hard to be for sure you're going to feel this, for sure you're going to feel that. It doesn't necessarily mean that. Everyone is different, and it kind of depends on where your brain tumor is and what else it's affecting. Let's see some of the other questions here. Thank you so much. My mom has stage 4 endocarcinoma, lung and liver. She's on hospice, has been for over a year now. What does the end look like? So if she's been on hospice already for a year now, I say her end will look a lot like what it has been looking like. So If she hasn't had tons of pain or tons of issues, she probably won't. Depending on how bad her liver is affected, she may start having some symptoms of end-stage liver disease, which is like ascites, which is fluid in the liver that you need drained, jaundice, some confusion. She may have some shortness of breath since the cancer is also in her lungs. But also, and I'm not just saying this, I really mean this, I would ask her hospice company. So the hospice company you've been working with, they've been working with her for a year now. So you can say to them, hey, what can I expect? And sometimes it's not a whole heck of a lot, especially if she already hasn't been having tons of symptoms. My question is, during the actively dying process, does the patient know if someone is with them? I can't forgive myself for not being there when she died. Yeah, so of course I cannot say for sure, right? So I don't want to sugarcoat anything and say, oh my goodness, for sure they know and for sure everything's okay. I can't say for sure, but I do think people are more aware than we give them credit for. Also, I feel like people sometimes choose to die alone. So people always get very upset that they weren't there when their loved one died and they died alone. Sometimes I feel like people do that purposely, especially if they were very private or very prideful. They may choose to die alone. But also I feel like people can sense when people are around, and we do think hearing is the last sense to go. So we do think even if they're not really responding to us, we do think they can hear us, at least somewhat. It's a little bit harder to see the chat this way, so hopefully I can still talk to you guys. Are all hospice patients non-ambulatory, which means are they not walking? No, not all of them. People can walk around on hospice and be very ambulatory, yes. I'm also doing my makeup while I'm doing this. Oh my gosh, Joan says, this is 11 years off hospice, I think she just said. 11 years off hospice for, wait, this month is 11 years off of hospice for 18 months. Wow. My grandmother passed away last week and slept most of the time for weeks. She had dementia. Is sleeping that much part of the process? Yes. Most people, especially with dementia, they'll be sleeping 22 to 24 hours a day. How long can someone be on hospice with heart failure? A very, very long time. It just depends. So heart failure, end-stage lung disease are one of those diseases, dementia, Alzheimer's, Parkinson's, people can come on and come off hospice. How to know if a nurse could handle being a hospice nurse? You have to really believe that death is not the worst thing. I really, really believe that. And it's because of like all the other types of nursing I've done. Someone was talking about black stuff underneath or on their mom's mouth and tongue. Probably it was just because at the end of life we aren't great at hygiene. That's no one's fault. So that can cause like stuff to build up in their mouth, and also stomach bile can be like green and black. Nothing super alarming there. My sister's right eye looks like it blew up. Is that normal? I would ask. I can't really say anything, if something's normal or not normal. You have to ask the people who are with them to see it, the doctors and nurses that are with them. It would be like really unprofessional of me to try to give like medical advice over a social media platform. You know what I mean? How long after modeling starts does a person have? So you'd have to make sure it actually is modeling. They have to actually be on hospice and actually be actively dying. A lot of people confuse like peripheral vascular disease with modeling. So make sure that they're actually on hospice and actually actively dying before you consider it modeling. And then modeling is usually during the actively dying phase, so anywhere from a few days, a few hours to a few days. But if they're not on hospice and you just think they're modeling, it's not modeling. How did you know hospice nursing was right for you? Basically right away. What is the fast breathing in and out but continues on and on during the past couple of days of dying? There's probably not a medical word for it. No, it's probably just changes in breathing, which is very normal. Maybe Cheyne-Stokes breathing, but it has to be like quick, fast, and shallow, and then long pauses. So like like that. That's Cheyne-Stokes breathing. My mom pulled at her bed a lot before she passed. Was that terminal agitation? It could be. You know, sometimes it could be terminal agitation, but if they don't seem like super bothered by it, they're not hurting themselves or hurting anyone, and they don't seem like they're really affected by it, even if it is terminal agitation, I probably wouldn't medicate for it because I'm just going to go by how they look. If she's doing that, but she still looks really comfortable, I'm okay with that. Let her grab stuff, right? If she looks a little agitated, then maybe I would do something about it. But in general, it's okay. P.S. I'm kind of putting on a lot of makeup because I'm doing what I call getting TikTok ready, where I put on a lot of makeup and then make videos. What does the end for MS look like? You know, I actually don't see tons of MS patients, but the ones I have seen, it's a lot like Alzheimer's disease, so they eventually are just not moving much or eating much, talking much, and they slowly, peacefully die. But I honestly don't see MS very often. Not that people don't die from MS, but I just don't see it that much. Weird question. Have you ever seen someone have visioning but not die? No, I haven't. Oh, thank you for being here, Michelle. Do they get confused like Alzheimer's? Not usually confused, but they don't talk. Does modeling happen on the hands and feet at the same time? It can. It can, it doesn't have to. Sorry, doing it on my phone is not as easy as doing it on a computer. Any kind of pain, whether it's from lung cancer or not, would normally be helped by pain medicine. That's the usual thing. Convulsing at the end of life. I don't actually see a lot of people convulsing, but that can happen. And sometimes it's because of like irregular lab work that's happening. Sometimes it's because they have tumors in their brain, so that can cause like seizures. If it's not a seizure and it's just like twitching, that could be because like calcium's kind of high and you can have twitching. But if they're like really convulsing and you're like looking like seizure-like activity, it's usually because there's some kind of metastatic cancer or tumor in the brain. and that is causing seizures. And seizures look really scary, but we don't necessarily do anything for them. People who are actively dying are almost always unconscious. Almost always unconscious. Yes. Thank you for these questions. They're great. Keep them coming. Keep them coming. While I do that, I'm going to do my makeup. Hi, Juliet. Anyone else have any questions? Why did you choose to become a hospice nurse? Because I was an ICU nurse for about 10 years prior to becoming a hospice nurse. And I just didn't like it. I didn't like what we were doing. I didn't like how people were dying. Not everyone died in the ICU, but some people did, and it wasn't the greatest. And I thought there has to be a better way to do this. And I tried hospice because of that, and I fell in love with it. And then the more I did it, the more I was like, people need to understand what hospice is all about. My father-in-law passed from COVID. Why was he really ill and suddenly get better the day before? He lost consciousness and passed away. So I can't say for sure, but that could have been the rally, which happens in like 1/3 of all patients, where right before they die, they get quote unquote better, or they feel better, they have a really good day, and then they die very quickly afterwards. That's exactly what the rally is. It's like you're doing bad, boom, you have a really good day, and then boom, you die. It's really quick. So that could be it. We don't know why that happens, but that could be it. I love that you promote pain medication in this day and time. Why should anyone suffer? There's no way I would have watched my loved ones die in pain. Exactly, me too. Do you feel sad when you see people dying? It's not that I don't feel sad. It's like I understand that this is what it is, right? This is what it is. There's nothing I can do, right? There's like the serenity prayer. Accept the things I cannot change and the courage to change the things I can. If I cannot change this, nothing I can do about it, how can I be there to help this person? How can I help? And if I can help, that's amazing. So I'm going to help. So I feel good about helping. My son's 38, 2 years ago diagnosed with nasal esophageal carcinoma. I know from experience that hospice is the only way to go. Probably, this is not my forte, probably because it's a rare cancer, but either way, let him be the guide. Let him be the guide. Thank you, Sarah. My mother died with a smile on her face. Why? I can only imagine why. She must have been feeling good, which is great. And yes, that is common. Why do some people jerk at the end of life? Just the body shutting down? Just a reflex? I know we don't like to think about it like this, but truthfully, there is a biological part of death and dying, like strictly biological. Just like, why do babies cry when they're born? Right? So like a body is a biological body and doing biological things. So not every little thing, our person who we love very much, not every little movement that they're making in death means something. And we have to remember that. So I would say it's probably just a reflex. What do you tell families tell family if they think you are quickening loved one's death following hospice protocol? I feel guilty. I tell them, I 100%, I don't feel guilty at all because I know with 100% certainty I'm not doing that. We are not hastening someone's death. It's been literally proven that the things we're doing are not hastening someone's death. All we're doing, they're going to die. This is what the way I picture it is like they are coming to the end of their life no matter what. So we can help that in the sense of make it more peaceful by providing medications if they need it. We are not making them die any sooner. So that's what I tell them. And I really believe that. So I don't feel guilty. How do you really know when it's time for hospice? I think whenever you feel like you're ready and you don't want any more treatments or there's no more treatments to be had, I say go for it. I always say when in doubt, check it out. I would rather people come on hospice too early than too late. You can always come off hospice. It's truly your choice. It's not like you sign up for hospice and now you're screwed and you can't do anything else. You can always come off. You don't have to stay on hospice, right? So it's like, I don't know. It shouldn't really be a last resort in my mind. Have you seen people who are atheists have visions? Of course. Visioning has nothing to do with religion. Yeah. If so, how do they process their visioning? Really, just like anybody else. Really, just like anybody else. Hi from Sweden. I have metastatic breast cancer and now bone cancer. What's next? I would get a will, Sally, not because I think you're dying, but because it's really important to have a will. It's really important for everyone here to have a will. I would get that in order. I would talk about your diagnosis with people. I would talk openly with your doctor and you ask them, you ask your doctors, what's next? And if you were me, what would you do? That's what I would ask them. What if my husband had his eyes closed, breathing quickly, shallowly, looked unconscious, then suddenly talk to him and he'd open his eyes and answer me? Yeah, that's just part of life. That's part of the death and dying process. Sounds very normal to me. Someone said, as people say, sinners experience a horrible death, good people die in good condition. What do you think? That has not been my experience. That sinners die a horrible death and good people dying good deaths. Hasn't been my experience. People usually don't die neurotic and have a difficult time giving up control. So if you are like that, I would work on that if I were you. And I'm saying that to myself too, because I'm neurotic and I have a difficult time giving up control. So I would work on that because those are the people who I see suffer. One of my cousins died the other day. He was 62. His kidneys were poisoning him. He had a touch of dementia. I think he had terminal agitation because his wife called 50 times. He forgot he was end of life. Center was calling her, cussing her out because he thought he was locked out of his house. Sorry, this doesn't go on. I'm not sure what your question is. So Debbie, people ask me stuff like this all the time. The doctor had my sister tied to the hospital bed when she died. Why? You would have to talk to the doctor who did that. I can't answer that. Usually they have people tied to the bed if they are hurting themselves or others, or if they're intubated, meaning there's a tube in their throat on machines, and they're pulling that out. Or if they're pulling their IVs out, they'll have them tied down. But these are things you need to ask the doctor who did it. I have seen blue urine. That usually means some kind of medication they're on. I can't remember what medication though. It's okay. Do you ever get really attached to the family while you help their loved ones? I do to an extent. Definitely. Yeah. But in general, it feels like, it just feels good. But, lately I've been the admission nurse, so I've been doing admissions. So I'm not with the family all the time. Thank you, Rick. I'm glad you're here. Thank you, Angela. What do you do when someone begs you to like help them dye? I usually the mascara I use, by the way, is L'Oreal Luminous. If someone is like really asking me to help them to dye, that usually means they are suffering, so we're not doing a good job controlling their symptoms. So when that happens, I ask them why they say that, and then they say to put me out of my misery, and then I say, why are you miserable? And they say, because I'm in pain all the time, or because I can't move around and I hate it. And then I say, well, I'll tell you what I can do is really medicate you so you feel better. I can't do anything to make you die quicker, but I can medicate you to feel better. Would you like me to do that? And they usually say yes. And then I order medications. I advise the family when to give and how to give and blah, blah, blah. Talk to the doctor about it, get the orders. And then they usually feel a little better because you're treating their symptoms, right? Let's see. What was your best hospice experience? Gosh, I have like 50 million best hospice experiences. I love them. Please don't do makeup on videos. DP Paulson. DP Paulson, please don't tell me what to do in my own lives. If you don't like it, you can leave. I watched my father actively dying. His eyes were open slightly. Oops, I lost your comment. His eyes were open slightly at first. His eyes closed last day, then finally passed. I thought his eyes would open. Why did his eyes close? You know, everyone is different. Some people's eyes will automatically open, some people's won't. It just depends. My father tried to take off his oxygen mask. Is it uncomfortable? It could be. My sister was in hospice. It really helped her. Nothing to do with the doctor. Since I can't thank them, thank you. Aw, thanks, Debbie. So why do my makeup? I do my makeup while I'm doing this because a lot of times when I do that on like TikTok lives, it actually helps people concentrate. I do 2 different things while I'm answering questions. Also, I can do whatever I want. Is visioning just seeing people, or do they have conversations too? They have conversations too. They have conversations too, yeah. I mean, everyone's visioning thing is different, and not everyone experiences that, right? But some people do. Oh, that's so amazing. Thank you, ML. How does one go about getting on hospice and paying for it? You don't have, no one can pay for it. It's given to you through Medicare or through your insurance, so you can't actually pay for it. Thanks, Wesley. Are you literally promoting Ale-Up products while talking about dying? No, I'm not promoting products. What? I'm not promoting any products. I didn't even tell you guys what products I was using. People are really confused about why I'm doing makeup. I'm just doing it for the heck of it, you guys. How do you get more comfortable with death? Where do you start? I think like exactly with like what you're doing, just by talking about it just like this. by joining lives like this, by just talking about it, by being with someone that you feel trusted and safe with, someone that you think won't, shame you for talking about it, because I feel like there are people out there still who are not really ready, so you have to be kind of careful. But that's how you do it. You just start. What causes their temp to go up? We're not exactly sure. So I know, so at the end of life, we do stop being able to control our core temperature. So our temperature will go up and down, and we start spiking fever sometimes for some reason. So we're not totally sure why, but that is something that happens and it's normal. Usually you can use cooling measures, meaning just like cold cloths on the forehead, underneath the armpits, underneath the knees, or Tylenol suppositories we give sometimes, which are helpful. But it is kind of hard to like turn somebody and give them a suppository, so a lot of times we'll just use cool compresses. Let's see. There we go. Just have to. I had to hide some people from commenting. What's your experience with Suboxone for pain? Just starting using this long-acting opioid a few months ago. So Minnesota girl, we don't use Suboxone, at least in my hospice. I think Suboxone's good for addiction. Give Suboxone for people who are trying to get off opioids for who are addicted. But I have heard in recent days that doctors have been using it for pain control for people with chronic pain. But to be honest, I don't know. I don't know enough about it. I would never use it for a hospice patient. Never. Not that it was bad. I just don't want to block opioid receptors, pain receptors in the brain, and Suboxone does that. So I don't want to do that for a dying hospice patient. But I do think that drug has its place. I still like the idea of cannabis meds before opiates. Yeah, me too. I love cannabis I love people using cannabis for pain control. Someone just mentioned methadone. Yep, I love methadone for hospice patients. We don't use it a lot because it's hard to titrate, bring up and down, because there's like a high chance of overdose and stuff. Like you can just get it wrong. So you have to be careful, but I think methadone is a great way to manage pain because it works on 2 different pain receptors in the brain, so you can get really good pain control. I guess I'm asking, can you always control pain and anxiety? For the most part we can. Not always, but for the most part. We can control pain and anxiety. People have to be willing to work with this though. But certain diseases are harder than others. Certain personalities are harder than others, right? A lot of times people die how they lived. So and I'm not trying to shame someone here. I will be an awful patient if I ever am one. I like control. I don't like losing independence. I don't like listening to doctors. Right? I'm sober, so it'll be hard for me to start taking opioids if I have to, but I will if I have to. But yeah, for the most part, we can help. Oh, good. So Cheryl just said, I'm on Suboxone for long-term pain. It's amazing. Oh, shoot. I keep losing these things. It's amazing for coming off opioids. Saved me, but listen to Julie. Not appropriate for short-term use. Okay, thank you. But that's great that it helped you. Most nurses are terrible patients, right? What can go wrong for someone to say their hospice experience was horrible? I know that, and that's not, you're not the first person who said that. People have definitely told me their hospice experience was horrible. And I'm so sorry for that. Fortunately, people in healthcare, we're human too. You know what I mean? So sometimes we get it wrong. Sometimes we're understaffed, right? And the patient suffers and the family suffers. And it's awful. I'm so sorry about that. I'm so sorry about that. It can definitely happen. Come on in. I've taken care of my mom for 2 years. How do I know if it's time for hospice? I would talk to your doctor about it. Talk to the doctor, see what they think. How will I know my husband who has cirrhosis will be ready for hospice? I'm scared to death waiting. I would talk to his doctor. You gotta talk to the doctors. They're with them all the time. A lot of things like, depending on what the disease is, cirrhosis is, they'll know when someone's ready. If it's dementia, it's really hard to know. Does Medicare pay for hospice? Yes. Medicare is our boss. Medicare is our boss. That means anyone, no matter where you are, in America at least, should get the same stuff with hospice. Does it hurt to die from a heart attack? Not long term. If it does hurt, it's usually for like a split second or two. But sometimes no, it just depends how quickly it happens. Liquid Ativan for his anxiety, restlessness. Thank God. Hospice was wonderful. He only got hospices last week while actively dying. Wish he would have gotten it sooner. Yeah, I know. That's what I'm trying to push for. People to get on hospice sooner rather than later. Tanya, as long as your boyfriend stays on dialysis, no, dialysis can keep you alive. Can people sense they're going to die? I think so, sometimes. Not everybody always, right? But I do think you hear stories of people knowing something's up. People in hospice definitely know. Has anyone who had ever had paranormal experiences ever asked ghosts if they know cures to the problems that people are in hospice for? Ooh, Mark, that's good. I have never, but that's a good idea. How often do you see your hospice patients? So I actually only do admission work, but prior to this, when I was a case manager, I would see patients, sometimes once a week if they were doing good, twice a week if they weren't doing good, 3 times a week if they were really having symptoms. It kind of depends. We are seeing so many medical professionals burning out. Is this true for hospice nursing? I think it's true for like all nursing, but I do feel like nurses in the hospital since COVID are really hitting it hard. You know what I mean? They're really hitting it hard. So, because they were in the hospital dealing with all the COVID crisis, we as hospice nurses, at least me, because we were going into people's homes, we still hit it hard. It was still stressful, but it wasn't as bad. I think in general, it's really hard to not get burnt out as a nurse. The only reason why I am not burnt out and I still love my job is because I work in California, we're unionized, and I work per diem. I still usually work about 40 hours a week, but I still make my schedule and kind of come and go as I please, so it really helps me. But a lot of people don't have that, they can't do that, right? So it's harder. But you have to really, really learn, and it takes time and energy to learn boundaries. And being a union nurse in a union, man, night and day. Night and day. It's amazing. I'm so pro-union. Holy moly. It's like changed my world as a nurse. Palliative care patient here. Oh, thank you. My daughter loves you too. Oh, thank you. Have you had hospice patients who have had heart failure? Yes, Tanya, I have, but usually not till the very, very, very end. People can live with heart failure for a very, very, very long time. When I am talking and I have the chat up, do you guys see the chat over my face, or do only I see the chat? Have you ever worked with death doulas? Can you believe this? I live in Los Angeles, where I'm sure there's a million death doulas, and I have never worked with a death doula. But I would love to. I feel like it's a great new career coming up. I wish Medicare and insurance would pay for it so the families wouldn't have to. But in general, I think it's great. Not over your face. Below you can see the chat, but it's not over my face. Good. Okay. I caught alive. Hi, Lovelace. Okay, good. Only a death doula is like what a birth doula is. They help people prepare for death. Oh, wow, Alvic. It makes me so happy that I've helped you, not that your brother's on hospice. Thanks, guys. I don't really watch other nurses except for hospice nurse Penny. Her and I are like besties. So we talk all the time. As a new hospice volunteer, your videos have taken a lot of fear away from me. That's amazing, Lisa. What does your work hours and schedule look like? So I usually work a Monday through Friday, 8:30 to 5 schedule. I have to work 1 weekend a month, and I can come and go as I please, kind of, because I work per diem. So I work for a large corporation who always needs me, so I can kind of work when I want to work and not work when I don't want to work. How do you control anxiety when people can't breathe with COPD? Morphine, 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 and Ativan. That's only if they're on hospice, but yeah, lots of morphine, lots of Ativan. How close to death can a rally happen? Probably like a week or two, usually. Usually. Because what happens is they look really bad, and then pew, they get better, and then boom, they die. So it's like quick. The rally, if someone is like better for weeks, I wouldn't consider it the rally. It has to be bad, 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 really good, and then they die, or they quickly die after. That's why it's like pretty obvious. It's kind of like, holy crap, they were so good, and now they were so bad, now they're so good, and now they're dead. You know, it's a very quick happening. The death doula will come in whenever they choose. So it's kind of like what they decide with the family. Sometimes the death doula is there before the person dies so they can plan everything and talk to everybody. Sometimes they're there when they're actively dying. Sometimes they're there afterwards. It just depends on what they all decide together. Can you sense or pick up on the paranormal? Vinny, that's a great question. So I don't normally talk about this on my page because it's not really what my page is about, but I would say in general, yes, ish. Yes, kind of. I don't necessarily go into it that much because I'm like too scared. But I do feel like I have some kind of spidey sense a little bit, yeah. What if morphine is not well tolerated by the patient? Great question, Carol. Yeah, so we'll either use a different form of pain medication until it's something that works for the patient. Maybe Dilaudid, maybe fentanyl, maybe something else. Have you ever witnessed patients talk about their loved ones in spirit coming to collect them, or talk about seeing angels? I remember a lady talk about angel before she died. Yeah, Chev, so that's called visioning, and I see it in like almost all of my patients. How many die from overdose by caregiver? Oh my gosh, I wouldn't know. I would say none, but I'm sure there's probably some somewhere. But I think people think because we have so many people who OD on pain medicine, because it's horrific and super sad, and it's a whole problem we have in our country. I think people think it's easy to do that, when in reality, most people who are ODing on drugs for the most part are shooting it, or they're taking like really, really high doses that they're not used to, or they think they're taking X amount, but really they're taking something much stronger, and they're usually shooting it, meaning it directly into their veins. So they OD, and it seems like that's easy to do. Now, people in hospice, we're giving small amounts and not enough to really cause respiratory arrest, which is what people, how they OD, respiratory arrest. They stop breathing and then it stops their heart. So people may think they're quote unquote mercy killing their loved one or giving up more than they need, and that's why they die. And they're probably not. The person's probably already dying, and they just gave them, like, you'd have to give. I had a doctor once tell me that she had a patient drink a whole bottle of morphine and trying to, I know I have a ton of hair, trying to kill herself, and she didn't die. She just slept really well. So I think people think it's actually, people think it's easier than it is to quote unquote like mercy kill someone. So I don't hear of that a lot. Also, a lot of people who don't tolerate morphine well via IV, like being pushed into their veins, but they'll tolerate it better liquid. My mom was on Dilaudid and Valium 12 days and did not wake up. I'm a nurse and have done hospice. Most of my patients wake up on and off. Yeah, everyone's different too. Did she have kidney issues? Because a lot of times people with kidney issues will not wake up. Hi, Papa Kilo. It's a good name. Do you ever sense that someone's dead relative is trying to communicate through you? No, I don't, Vinny. I don't. The only thing I ever sense is like the person dying kind of like sending me their energy or something, if that makes sense. Like it's kind of like a knowing versus like hearing, or it's like a sensing, if that makes sense. And it's usually the person dying. And I would never say this to the patients or families. I don't want to freak them out. So I just keep it to myself. And I don't fully understand it, so it's really hard for me to try to describe it because I don't even really understand what's happening. It's just kind of like, it's like a knowing. And I feel like I can kind of sense it, and I kind of feel like I can kind of feel what the patient's trying to tell me, if that makes sense. And not always, only sometimes. When my dad took his last breath, just thought it was his last breath. There was one gasp later, and it just shocked me, even though I experienced this before when I watched my cat die. Is this common? Wesley, I'm so glad you asked. Yes. Yes. So people at the end of life can almost scare people, right? Because they think, oh my God, that's definitely their last breath. I just watched them take their last breath. And then like maybe even like a minute later, they'll go, and people will scream. People, I even jumped once because I was just not ready for it. And it's basically like air just leaving the person's body, or agonal breathing. So I don't even know, agonal breathing isn't really true breath. So it's just a bodily reflex. But it's really scary and really hard for us because this is our loved one. This is a huge moment for us and for them, and it's filled with all types of feelings and whatever. So yes, it's normal, and it's truly just the body fully shutting down. Big no BS, that's amazing. Oh, did you tell us where I'm? Oh my gosh, Gammy B, you're so cute. You know what? I'm not really going anywhere. I just like doing my hair and makeup, and I like doing it on lives and answering questions and doing hair and makeup. Apparently, not everyone likes me doing that, but I like it. I think it's fun. I am one of the leads to implement a palliative approach to care, or at least introduce the topic in our home to make families more comfortable when the time comes. Still scary for some families. Yes, and I'm so glad you're here. My mom is in hospice. One nurse reminds me of Julie. She's amazing and so down to earth and honest with me. She even brought me some cookies and coffee. Aw, that's amazing. Have you ever had a hospice experience that left you feeling disturbed? So, Jude Blake, I like your name. Yes, I have. I've had a couple, and mostly it is when we can't get the symptoms of the person controlled, like we can't get their symptoms controlled, or we're trying to respect their wishes and not do anything that they don't want us to do. So some people really will say, I don't want Western medicine. I only want Eastern medicine. I only want herbs. I only want this. I don't want morphine. Even when I'm unconscious, don't give me morphine no matter what. Don't give me whatever no matter what. And so we listen. We will respect what they want, right? And there's been a couple times where we had to do that, and it was disturbing because their symptoms were not controlled, and they basically died suffering. And it's sad. And it's hard to watch, right? So a couple times like that. And I just leaves me feeling sick. Do you think that legal euthanasia will ever be legal in the States? We kind of have it here in the States. There's 11 different states that allow someone to drink their own end-of-life medication and they die. And I've witnessed that several times. It's very beautiful. And I believe in it very much so. So I don't know about a doctor actually pushing the drugs. I don't know if that'll ever be legal. Okay, now I'm gonna go basically done. I just need to put lipstick on. But we do have a drink people can drink if you live in one of the 11 states. And I do. California is one of them. So I'm all for it. It's beautiful and amazing. And yeah. Canada, they will inject you. Give me morphine all the time. Keep me asleep. Thank you for your opinion. A fish head. I have a friend who's a fish head. Do you believe in euthanasia? Yeah, I do. It's not legal, so we can't do it. But thanks, Papa. Thank you, Cheryl. Witnessing someone, what's the mixed drink? So I don't think I legally can tell people. It's the same medication for everybody, but they have to do it in different doses. Oops, depending on the height and weight of the person, right? But to witness someone doing that is pretty incredible because and they know what's happening. They know they're gonna die. They know I'm gonna drink this drink and I'm going to die. And it's really powerful. It's really powerful to be there to witness someone doing that. And what happens is, so they have to be able to legally mix this drink up themselves, and then they have to drink it in it's like 3 ml, so a very small amount of fluid. And they have to drink it quick. That's in one of the directions. You have to drink it quick. And once you drink it, I'm talking 3 to 5 minutes, you're out. Totally out. Not just like kind of sleepy, you are like zonked, zonked, zonked. Like you almost look dead, but you're not dead, you're still breathing. So, those are, even though I really believe in it, it's still hard to watch. It's still like, wow, this person who was like very alert and oriented a second ago, who knows what's happening, they have chose this, they're saying goodbye to their families, and now they are drinking this drink and they are going to bed. And then they die. So they fall asleep, and not just like kind of asleep, they fall asleep. They're like basically rendered unconscious. Like 3 to 7 minutes.
Every time I've witnessed it, it's been like 3 to 7 minutes probably. And then probably about another 45 minutes until they actually take their last breath. But they're not awake at all during that time. They are very, very almost like they're in like the actively dying phase, like changes in breathing, changes in skin color, you know, for like 45 minutes, and then they die. But it's very, very painless, fish head. It's painless. There's no pain. There's no pain in it. So what the medication does is you take anti-nausea medicine like an hour beforehand, then you drink the drink, and it basically sedates you like big time. It just basically knocks you out. And then it takes about 45 minutes for the other medication to be digested in your stomach. And then once it's digested, it stops your heart. So it's not painful. I have ALS. This is really helping me. I won't be choosing euthanasia. I have the Lord, and I'm leaving it up to Him. The best is yet to come. That's amazing, Kathy. That's the great thing about this is no one has to do it, right? It's like it's very much their choice. Their choice. Yeah. I've been working for hospice for 16 years as a music therapist. Yes. I love how medication and music therapy can work so well together to help with pain and anxiety. That is so amazing. You know what's really crazy? So I understand pain in the sense of I get really, 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 really bad migraines. And I'm sure some people understand. And they're cyclical too. They're like chronic and cyclical. So it's like for like 2 weeks, I'll just be like basically in constant like gnawing pain in my neck, in my jaw. And it can be exhausting because it's like chronic, and I don't take pain medicine, but I take like migraine medicine, and I take basically that's it, migraine medicine. And sometimes it works and sometimes it doesn't. But you know the one thing that works and it's so freaking trippy and it almost pisses me off is distraction. Like if I can distract myself, the pain goes away for a little bit. Like if I can if I can distract myself, the pain goes away. And then like that's why I still work when I'm like that, because going into a patient's house and not focusing on the pain in my jaw and neck and going to focus on them actually helps me. My pain will go away for a little bit. Or I think a lot of you guys know too, I'm sober and I'm in a 12-step program. A lot of times, even if I feel really sick, like from pain, from migraines and have like nausea and stuff, I'll still go to meetings and I'll leave the meeting and I swear to God, I will feel better. I'll feel better. And I'm like, how can this help with physical pain? It makes me feel like I'm a little nutso, but I think a lot of it has to do with distraction. It took me over a month to get a doctor to agree to get my mom on hospice. Wow. Why aren't doctors trained to recognize impending death? Ooh, I don't know. That's so horrific. I run into the same problem where I'll hear oncologists, not all oncologists, but some oncologists, those are cancer doctors, be like, I don't think we should give up yet. I don't think it's time. What? This is not your call. This is not your call. Especially if the person's asking about it. And give up. I don't like this whole like analogy of like fighting and giving up. Hello? This person is not giving up. You will have relief from migraine towards menopause and maybe down the road for you, but migraines for 10 years straight, finally over. Thank you. Yes, nothing. Yes, exactly. Hormone induced for sure. More for inflammation. Yeah, and I have inflammation issues too, and usually I take steroids and stuff, but this month, for some reason, the steroids didn't work. Cannabis in every form, smoke, edible, drink is helpful for pain. I know, Ganja Fairy. I am dead ass sober, man. I'm very sober on all levels, so I can't. But I'm more power to you, to anyone else who wants to smoke it and drink it, if you got it. Minimize gluten. Thank you. It'll help. Has anyone heard eggs? Do eggs help it? Imitrex really helped me. Yeah, Imitrex helps me too. Imitrex really does help me. I took some today. But yeah, I always think about my diet too, but it's definitely hormonal as well. I can tell it's like a cyclical thing. Really proud of your recovery. Thank you. 4.5 years. Yeah, I have 6.5 years. February 4th is my sober date. Oh, thank you, Allison. Thanks, Sarah. This has been a pretty long live. Thanks, Shannon. You know, they're talking about using psilocybin. There we go. I always have a psilocybin for existential issues for dying people. And I'm all about it, man. I'm all about it if people want to. I have a friend that's in hospice. She's 47, dying of cancer, won't see anyone or talk to anyone. How often do you see that? I see that a lot. She won't even talk to family, or does she talk to her family? Julie, do you ever open windows when someone has passed away? I've heard it's important to let the spirit leave, float away. I've done this for my pets. So, Morgan, I don't do that only if a family asks, only because I don't want to upset the family and say something that they don't believe in or they, whatever. I let the family lead the way, so I don't do it. But if they say, should we open a window? I say, oh, do you feel like you'd want to? Or if they say, can you open the window? I will. So I usually let the family be the lead. Thanks, Phil. Thanks, guys. Oh my gosh, Victoria says, hi, Julie. You've inspired me to apply to be a hospice volunteer in my community. Ooh, 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 that's so amazing. Yes, we always need hospice volunteers. That's so awesome. My mother's eyes were open the whole time. They gave her so much morphine, but she would not let go. Yeah, and was totally awake. So, Henrietta, I have a feeling, I could be wrong, but here's the deal with the eyes. So, it actually takes muscles to close your eyes and to blink and to keep your mouth shut. This takes muscle. When you're dying, all of those muscles loosen. And your eyes start staying open, and you can't close your eyes and your mouth is open, but your eyes are kind of glazed over and you're not making eye contact. I have a feeling your mom wasn't really there, but her eyes might have been open. I don't think she was actually awake. It's very, very normal for someone's eyes to be awake the whole entire time. It's very, very normal for them to not be open, and then suddenly they take their last breath, and all of a sudden, boom, their eyes open, and it almost scares people. That is because they literally lose all muscle control. Their body fully lets go. And everything opens, including their sphincters sometimes. So fluid can come up. Fluid can come out of their butts, like all of the things. It doesn't always happen, but it can. And that's truly just the body. So yes, very normal. And I don't actually think she was awake. Now, I wasn't there. So if she was actually looking at you and reaching her arms and stuff and acting awake, then yes, maybe she was. But if her eyes were just open, but she wasn't really doing much, I don't think she was awake. Ottawa here. How are you? I'm okay. I'm okay. Hey, Southern gal. Aw, thank you. Riri MR. What does a hospice volunteer do? So it depends on what hospice you work for. So my suggestion is, if you want to be a hospice volunteer, Call around to the different hospices in your area. Now, if you're in a big area, you're going to have a bunch of them. If you're in a small area, you maybe only have one or two. And you ask them, hey, how do you utilize your hospice volunteers? And then they should be able to tell you. Or they might say, it's up to you. Blah, blah, blah. All I know is you're not allowed to physically touch the patient. You can't touch them or do any kind of nursing work. But you can get groceries for them or sit with them and read to them or whatever. So I would start there, call your hospice company. I think they usually always need volunteers, so I would just start there. Start there and see which companies sound the most interesting to you, however they utilize their volunteers. Can hospice be done somewhere other than your home, i.e. mountain cabin, not close to a hospital? They can do that if there's a hospice near that area. Sometimes there isn't. So then you can't, which sounds crazy. A New Pair of Glasses. I love that book. The human body is amazing, and it knows how to shut down gradually. Amen. Papa Kilo. Kathy, you'd have to talk to somebody in Ottawa about that. I have no idea, unfortunately. Is Tylenol the leading cause of liver problems? I thought alcohol would be. Do you think people are actually afraid of dying or just being dead? I think people are just afraid of the unknown. People feel afraid of things they don't know and understand, and then be perpetuated by being let's not talk about it. Let's not talk about any of this, and just pretend like we're not afraid or deny that we're afraid, which makes us even more afraid. So yeah. I'm so glad I found you a few weeks ago. Thanks, Kimberly. Are there common symptoms that will cause an MD to recommend hospice? Usually an MD just sees this particular type of disease, whatever disease it is, a bunch, so they know what end stage looks like. That's why. Or, so I'd have a better idea knowing what disease you're talking about, but usually the MD will know this specific or certain specific groups of diseases well, and they'll know when to say, hey, it's probably ready for hospice. But sometimes they just don't know any better, and they sometimes with dementia, doctors just don't know better, and they'll say people with dementia should go to hospice, but really you can't get on hospice with dementia till the very, 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 very end, which can take years and years and years. You have to be bedbound, nonverbal, difficulty swallowing, aspiration pneumonia. It's a lot. Yes, Kathy Hall, that is very true. My cousin has carcinoma with unknown primary. They gave him 6 months. When should he go on hospice? When he is no longer seeking treatment. If he's no longer seeking treatment or any kind of studies, I would go on hospice. Can you go on hospice and come out and come back again? Yes, you can. You can come on and come off, come on and come off. Yes. All right, you guys. It has been 68 minutes. You have been with me while I did my makeup, while I did my hair, and now I'm going to go. But thank you so much for sticking with me. This has been really fun. I'm probably going to post this to my page. It's a little long. We'll see if people like watching it while I do my makeup and hair. They might not. But you guys have been really great. I'm cleaning off my camera here. There we go. Woo, that looks weird. Anyway, thanks so much, you guys. You guys have been really great. So much fun. And whoever gave me the $2 up there, thank you. I just noticed that. And that's great. I'm also on Instagram, TikTok, and Facebook at Hospice Nurse Julie. Basically the same stuff everywhere. So wherever you like to get your info. All right. Have a good weekend, guys. You take care. Bye.